populations that have not historically felt welcomed into the healthcare industry. So we're learning that the industry is evolving right before our eyes. But are we ready? Are we ready to tackle the challenges that today's age of personalization has really enlightened healthcare, not just providers about, but the entire industry, but most importantly, its leaders? How prepared are healthcare leaders for the change that not only are we grappling with, but what awaits us as a consequence of not only COVID-19, but the social unrest that we felt all across America? Now, to address these issues, Gyasi has really provided us some perspective to think about, that healthcare needs to start thinking differently about being so mission-minded. If I could be so direct, we've been part of a healthcare system that is really focused on hope, hope for cures, but in a manner that maybe isn't so intimately connected to the individual. On the flip side, there's a movement that's taking place, one that requires us to lead differently, recognizing that healthcare is no longer just a vertical anymore. It's a horizontal, and its future, much like every other business sector's future, is dependent on this convergence that we all need each other more than ever before. And Gyasi's going to address these issues again as healthcare needs to move from mission to movement. Now, before Gyasi joins us, I'd like to share the following video of Gyasi when he spoke at the Leadership in the Age of Personalization Summit in October of 2019. So when it comes to population health, how do you approach it beyond just legal compliance?
Yeah, great question. I think the whole notion of population health back in the sort of the early and late 90s, and I'm looking at Tim and some other colleagues here in the room, there was a lot of emphasis on population health, right? How do we look at a segment of the population and treat them like a segment? You know, I'm taking all white males and I'm going to treat them this way, or I'm taking everyone that lives in this zip code and I'm going to treat them that way. I think we are swinging the pendulum ever so slightly and slowly to go to more customization, i.e. personalization. And I think that's opportunity to kind of safeguard against that standardization that I think has occurred a lot in healthcare, particularly as it relates to cancer, because every cancer is different. Every cancer type is different. Through clinical trials, we're learning a ton of things each and every day, but even more importantly, cancer impacts the body differently. There are certain drugs that don't always impact the one person the same way as another person. So there's tremendous opportunity to really take personalization, i.e. customization in medicine, and have that top of mind.
So if you're not in healthcare and you realize that the shifting demographics are going to require them to provide more personalized benefit plans, how do you get an employer started? What kind of strategic partnerships are involved with something like this?
So I always like to say there's sort of 4 P's to healthcare. It's the patients. Obviously, we should start with the patients. We don't always do that though in healthcare, unfortunately. 2 is sort of the policymakers. 3 are the providers, and 4 are the partnerships. So we are deeply rooted in partnerships, not just internal to healthcare, but even more external. We really wanted to make sure that there's opportunity for us to kind of look at healthcare differently. Good. Because everything that you put in your body, that's what's going to come out, right? I think we're all in healthcare in some way, shape, or form, in some capacity, and it gives us an opportunity to kind of look at healthcare as a sort of a framework and not just an industry.
Yeah.
So I read a study. I think this was in Harvard. The Harvard Business Review. And one of the things that they said is that the healthcare part, the healthcare medicine, is only roughly about 10% of health. Everything else is related to environmental factors, to the food that we eat, to everything that we touch, to where we live. Those are the kinds of things that we should be kind of putting into our psyche as we move forward, because those are the kinds of things that are going to determine if we get cancer or not. That's going to determine if we have a chronic disease. So those are the kinds of things that we're thinking about and how we're partnering at CTCA.
Now, before I have Gyasi join us, I'd just like to remind all of you that this is a Q&A session. You can address your questions through the Q&A module on the Zoom panel. You can send in your comments on chat. We have GLG staff on hold and awaiting for your comments. We want to make this very conversational. Also, I'd like to just thank everyone for taking the time because we could all see that Gyasi's an extraordinarily dynamic speaker and is really passionate about the future of healthcare. In fact, Gyasi will be a featured speaker on day 2 of our 2020 Leadership in the Age of Personalization Summit. You could learn more at 2020summit.ageofpersonalization.com. The summit will take place in partnership with Fairfield University on October 28th through the 30th. So Gyasi, why don't you join us? Gyasi Chisley, President of Cancer Treatment Centers of America. Thank you so much for being with us, Gyasi. I bet you that video brought back some good memories, huh?
Can you guys hear me?
Perfect.
Fantastic. So pleasure to be with you and your audience. It brought back some very fond memories. I love our discussions, Glenn, and I get impassioned and certainly fuel and inspired by all of the feedback that we've gotten, not only from this summit, but the one that's coming up. So really looking forward to it. And thank you for your time today. And thanks for everybody joining. Really appreciate it.
No, so Gyasi, so take us there. I mean, recently you and I, and we've had numerous discussions. I know that what you've observed in healthcare, not just with COVID, but social unrest, has weighed on you. And you've come to me and said, you know, there's got to be a way to move from this mission-driven mindset to something more. So break it down for us. What do you mean that healthcare needs to move from mission to movement?
Yeah, I like how you started it, and thank you so much for that warm introduction, Glenn. I am struck by the fact that we're living through history at this very tender moment in time, given everything that's going on with the 3 Ps, as I like to sort of position them, the pandemic, the protests, and obviously the immense loss of profit within this country and throughout the world. I think we've got a wonderful opportunity now to act. And mission, I think, is certainly can serve as a guidepost, and many healthcare institutions, IDN, integrated delivery networks, health systems across the country have missions, and most of them are even rooted in any religious sects or facts, or any other things that sort of that health system holds near and dear to the heart. I think that creates an opportunity for us to use those guideposts and utilize the 3 Ps as momentum. And if you take that word and break it apart, it has moment in it. And this is our moment. And if you use the last 2 words, and if you break it up, the last two letters, I should say, the U and the M, I think we have a wonderful opportunity to study our utilization and our management, which leads to leadership. So that momentum can create the movement to actually get to what we need to actually start to aspire to. And that's going to require a lot of leadership. It's going to require a lot of courage. It's going to require a lot of credibility and creativity. But most of all, it's going to require commonality. And what I mean by commonality is the opportunity to really connect with the people in which we serve, connect with the communities in which we serve, so that we can get to that personalization that we all desire.
So, Gyasi, let's break this down a little bit more because I want to get this call a little uncomfortable, okay? Because these are things that right? Because I think people recognize that there's a need for something new. But you know, we see in healthcare that historically, again, and again, subject for debate, and I'm not here to create any disruption more than just thinking, is that it's operated based on how do we save lives of maybe select populations through higher quality of care? And now, as we get into this movement, it's about how do we save lives across all populations through the highest quality and methods for care delivery. What do you see as different in that line of thinking between the two?
Yeah, it's a great question, Glenn, and I think it speaks to some of our discussion and the snippet that you showed during the summit. Are we really truly looking at populations, or are we really trying to customize care in which we know that healthcare is probably most effective when we do so? So in my mind, there's tremendous opportunity for us to look at different populations in a different way. So it's okay, I think, to actually understand how diabetes affects African Americans and affects certain zip codes within this country. It's okay to study cancer and make sure that a sweeping generalization like lung cancer or certain aspects have on the body. It's not okay, though, to not understand how that affects John Smith or Joe Jackson. We need to make sure that we're customizing medicine as much as we can, as early as we can, so that we get the best outcomes. That will also inherently kind of go to our opportunity for the other two legs of the stool, if you will, both cost as well as satisfaction. So the cost, quality, and customer satisfaction is always that top of mind for any healthcare executive. But if we do this and do it effectively with the patient in mind, we'll get better outcomes and we'll be a better industry for it.
So, Gyasi, I'm going to have a little pushback here, but isn't this how we should have been
Please.
thinking a long time ago? I mean, what's going to
Yeah.
change? What needs to fundamentally change from a leadership perspective so that we take what you just eloquently described into action? What needs to change?
Yes. So in healthcare in particularly, and it's much to my chagrin and dismay, Glenn, we have the sort of Dallas Cowboy syndrome. Do you know what the Dallas Cowboy syndrome is?
I don't.
So the Dallas Cowboy syndrome is, oh, we'll get them next year. So since the mid and late 90s, they haven't won very much. So I know a lot of Dallas Cowboy fans that always says, oh, we'll get them next year. And I think we've adopted that sort of mentality, that personality, that sense of incrementalism in healthcare, which really, really just tears me apart. I think it actually speaks back to, or goes back, or harkens back to what we've been discussing in terms of our mission. You know, our mission requires us to, look at a broad swath of people and make sure that we're trying to, at times boil the ocean. If we can get super specific, if we can get even more customized, I think there's opportunity inherent in that. What do? I think we're all complicit in it. I think exactly what I stated at the summit late last year, is certainly germane now more than ever, and that is everybody's in healthcare. Everybody should be rolling up their sleeves, trying to understand healthcare in a different form or fashion. I think there's tremendous money that is being made because healthcare is so convoluted. I think there's tremendous money that's being made because healthcare is so ambiguous. I was looking at a program the other day with Chris Evans, talking about his opportunity to do and unpack politics a little bit. And what he's done, I don't know if your audience knows Chris Evans, but Chris Evans is Captain America. He's an actor living, I think he's from Boston, the Boston area, but he has been in several Marvel pictures acting as Captain America. What he has started, I think, is something that we can take and apply to healthcare, and it's called a startingpoint.com. And what a startingpoint.com does is break down politics for the layperson. It gives sort of insights on both sides in a very nonpartisan format on what we need to do and how we need to do it. I think if we can unpack and demystify healthcare in a very straightforward form, that therein lies the opportunity to decrease or at least mitigate some of that ambiguity. And that's opportunity for us. And I really want to make sure that we do that as well. I think we can take a page from that book. The other thing that I think we can do is just as all collective leadership and concerned citizens, we can come together. There's power in partnerships. There's power in proximity. So if we know that we've got opportunity, even in the midst of a global pandemic, to come together, get like minds and like mission people together, that's opportunity for us to kind of come up with solutions that I think will be long lasting and maintain and sustain themselves throughout the throughout the years to come.
So, Gyasi, as I'm listening to you, it reminds me of a phone call I had early this morning with an executive from Google. And right now they're working with hundreds of higher education presidents throughout the country. And what is the conversation about? Is it about, how do we transform to be better leaders and educators to students? How can we continue to strengthen our relationships with the communities? How do we keep our donors active? But where's the conversation? And what Google is doing is they've actually have done a student and parent mindset study, which, by the way, the numbers will be revealed at the summit on October 28th to the 30th. But what they've tried to do is turn the model around. I mean, do you really know what's happening with students and the parents who are cutting the checks? So what does this have to do with this discussion? When you talk about that there's power in partnerships, are we leading and solving the right things, Gyasi? So if you can kind of break this down, what have healthcare leaders been focused on solving for in a mission-based environment, and what should they be solving for in a movement-based environment? Because if we're going to build these partnerships, the question bears, do we have the leadership that can be much more inclusive, interconnected, and interdependent within the systems they lead, but also outside of the industries that really need one another? So what are your thoughts on that, Gyasi?
Yeah, I love that question, because it forces us, it's a very provocative question, Glenn. It forces us to look internally within ourselves, those that are in healthcare and those that we're trying to invoke and promote to actually come in healthcare and give us new solutions. I think what healthcare has done over the years, and I'm complicit in this probably more than anybody, is look at other healthcare leaders and borrow their ideas. So what does that lead to? That leads to a lot of standardization. We've been very insular for a very long time, and shame on us for it. It's an opportunity for us to look outside sort of the four walls of the industry and make sure that we've got new ideas, new concepts, new innovation to bear, which we're just starting to do. And I think we're actually getting some traction. But given the fact that with so much to unpack over the years, and given the fact that we've been in standardization or trapped in standardization for so long, there is a lot to do to get to customized medicine. There's a lot to do to actually get to cures, because again, the money is not in the cure, to quote Chris Rock, right? The money's not in the cure, the money's in the medicine. The money's in the actual treating the chronic disease. Healthcare for years has tried to crack the nut of treating chronic diseases, but we've also got a chronic problem in healthcare because we're continuing to look at things incrementally and not trying to transform. That transformation, in my mind, has to happen at the bedside. It has to start with new innovation, and it has to start with new ideas and concepts, bringing people in outside, working from sort of external in to make sure that we've got new ideas to bear. If you look at things, you look at a Mark Cuban, you look at a Magic Johnson, you look at new people coming into our space, both within the policy format, in the pharma format, pharmaceutical format, and some other things. That's opportunity for us to borrow and steal some of those ideas. Not to mention, and this is a key point that I'm hopeful that we'll get to a little bit later on, some of the newer Generation Z, the millennials, absolutely have added to this discussion. And I don't think that they're as trapped in standardization as an old fogey like I am that has been in the industry for more than 23 years.
So first of all, Gyasi, thank you for that. To our guest, remember, it's a Q&A panel, so we'd love to get your questions. Gyasi's ready to address them, but please, we'd like for you to get involved in the conversation. I see a few people like Jack and Michelle, Terry. I know there's things that you're probably thinking about right now, so we can get the conversation moving. You talk about millennials and Gen Z, and on Sunday, Gyasi, I published an article on Forbes called Digital Therapeutics is Moving Us Closer to Personalization. I haven't seen more dialogue on LinkedIn around a topic in a long time. And what really seems to have spurred on the conversation is that digital therapeutics is doing what? They're really putting the control of care in the hands of the individual. And
Right.
what the value proposition essentially is that healthcare, in let's call it the brick and mortar healthcare, was essentially created to cure people, whether it's through major trauma. But when it comes to chronic disease states, this is one where behavior change and putting onus on the individual to become more self-directed in making sure that they can direct themselves on a path to better health. It's inspiring individuals not only to take more ownership, but to really learn about how I can take care of myself. And as the article reads, I mean, patients for years have been told by doctors, lose weight, exercise more, watch your caloric intake. It's almost been an overwhelming burden for the individual. But through these digital therapeutics, they provide clinically proven methods for how the individual can take ownership for their care. So when you talk about millennials and Gen Z, when you talk about transformation, there are things out there right now. And as you know, this has an indelible impact on, and by the way, this is a strategy that CVS has really put a lot of muscle behind in strengthening their partnerships with large employers. And it has unequivocally been a game changer for them during this pandemic. So the question bears, right, Gyasi, let's shift here specifically to the patient. And I've thought about this in preparation for our call. If patients are consumers, do they even know what that means? And number two, do the healthcare systems really know what that means? How do we, I mean, because if we're going to solve more for the patient and now they're also the consumer, we keep talking about it, but are we prepared for it?
Yeah, great question. Question number one, as my grandfather would say, to answer your question, we're starting to become much more, call it sage, in our approach to our healthcare and empowering ourselves, enabling ourselves to do further research on what not only feels good, but is good for our respective bodies and our families' bodies. So we're starting to. Let me come back to that. Question number two, do the health systems actually understand that consumerism is at top of mind? I don't think so. I think health systems, again, going back to our mission, because mission to me is static and movement is so much more fluid. If you take a static moment, you are a big behemoth of a place, bricks and mortar, and you're waiting for people to actually come to you that are sick. Can you imagine that, Glenn? Like, I am asking you in your most vulnerable state and time of need, when you feel your worst, to, hey, why don't you get in your car, drive at least, 15 minutes, come to a hospital where other people are sick, expose yourself, and I'm supposed to make you feel better about not only your mental state, but also your physical state. That's hard to do. And it goes back to, why didn't we disrupt ourselves earlier in the process? That's a question that you and I will have to unpack and for future generations. There's a lot of things that we could have done and to understand, but things like telehealth, things like the digital therapeutics, things that I'm really excited about that I think will really touch upon the sort of social determinants of health, given the fact that we're now going in homes to actually administer care. Home health is going to be huge. It's going to be a game changer. And I realize that there are regulations around that. I think given COVID, which is, again, one of the things that we're having to get creative because of the pandemic, we're now being able to do telehealth in a different way because the regulations are relaxed. We're now being able to do home health in a different way, even infusing patients in their homes in a different way because the regulations are relaxed. We're hopeful that will continue and that government will understand that we have an opportunity now to get even more personalized with our care.
So Gyasi, this conversation has spurred quite a few questions, and so we're going to address them. So Shahab, thank you so much for asking your question. I'd love to invite you into the conversation if you'd like to ask your question directly to Gyasi. Go ahead, Shahab.
I'll be happy to, and thank you. It's your conversation is quite inspiring. I think when you talk about partnership, something that I believe as an industry we are struggling with is engaging patients in a meaningful fashion in an environment where incentives are not necessarily aligned. And I think in our industry, we have been used to suggesting that come to us and we're going to do something to you to improve your health. What is the role of the patient, and how does our fragmented system create opportunities and incentives to engage the patient in a more meaningful fashion?
Yeah, great question, Shahab. Thank you so very much for the question. And I often toss and turn in my bed at night because our incentives within healthcare are not aligned whatsoever. There are certain incentives for physicians, sometimes to see more patients than that they can even bear. And there's incentives for hospitals and health systems. There's incentives for the government, for the policymakers. And then to your question, very pointed question, and it's a good and a very astute call out. There's not a lot of incentives for the patients. Even when patients are taking control of their care and feel empowered and enabled to take control of their care, utilizing whatever resources they have, whether it be a phone or a watch or what have you, there's still absolute tremendous opportunity for us to not do things to our patients or even for our patients. It's an opportunity for us to do things with our patients and make sure that the care is collaborative. So I think just a couple of things really quickly. Number one is we should establish a plan of care with our patients. That has to go from top to bottom, hopefully with a caregiver in mind, particularly as we're working to treat cancer more as a chronic disease versus a fatal one, given the immense and intense sort of proliferation of chronic diseases in this country. I think there's tremendous opportunity for us to do that with caregivers and with the actual patients themselves. So that's number one. Number two, I think there's tremendous opportunity for us to, again, enable and empower our patients and provide different incentives for our patients so that they can get real-time updates on how the care is being administered. So I know that there's, things with, if you've got diabetes, there's things like glucose monitors that you can actually wear, or some of the digital therapeutics that Glenn mentioned. There's a ton of opportunities for us to kind of understand heart rates and heart monitors that you can put under your pillow nowadays. I think all of those things, while still being tested, are complete disruptors to the market in a good way that really will enhance and enable our patients to do different things in a different way and not always have to be dependent upon a PCP, a primary care physician, or a hospital to actually tell them what to do. They can actually be a little bit more proactive. So thank you for the question. I thought it was an excellent question.
And Shahab, I'm sorry, just because we're part of leading in the age of personalization, can you please just introduce yourself, your first and last name? I've had a last name that's been mispronounced for years, and I don't even want to take a stab at it. And let us know the role that you play in your work.
I'm Shahab Daju, Senior Vice President for a pediatric health system in Southern California.
No, thank you, Shahab. We greatly appreciate it. It looks like that you had a second question. Did you want to ask that as well, or did Gyasi address your curiosities?
Maybe it's a continuation of my initial question. When we talk about the fragmentation, obviously, when we think about personalization, it requires us to know our patients. And when I talk about knowing our patients, it's not about, again, dealing with a segment of the population. In fact, we've rolled out a very effective population health program, which has been nationally recognized. But the reality is we are still dealing with segments, not necessarily targeting individuals. Mm-hmm. And for us to target individuals means that we must be able to have responsibility for the entire episode of care without patients having the opportunity to leave the system and re-enter with which sort of complicates and adds to the ambiguity that I think you were discussing. So how does this work, which I think also relates to one of our partners being the payers? To what extent does this create an opportunity to have a three-way relationship where patients win by being healthy, payers are incentivized to participate actively, and providers do what's right?
Yes, great question again, Chab, and it is certainly an extension of your first question. I think you're spot on, and it goes back to one of Glenn's original questions about consumerism. I think the quicker we sort of pivot and not look at patients as a population or a cohort, if you will, of people that need to be instructed or told what to do, directed, so to speak, that they feel empowered, that we empower them with decision making and giving them a platform for those decisions. I think the quicker we can pivot toward that sort of construct, the better off our industry will be. Healthcare is very, very difficult. It's difficult to navigate, particularly when things are in different places. You have, heaven forbid, you're diagnosed with a disease, a chronic disease. You've got to go to your primary care physician. Then you might go to a specialist. Then you might go to an outpatient facility for radiology. Then you might ping back to your primary care physician for another sort of gatekeeping concept to see another specialist. All of that can take months, particularly with the way in which we schedule and everything else. That is particularly time consuming, but it's also mentally for the patient, it's really difficult. So I think if there's other things that we can do in between those episodes of care and make sure that we're looking at the continuum of care and incentivizing the patient to really make sure that he or she is taking control of that journey, taking control of that navigation, and making sure that we're marking all those checkpoints, ensuring that health is at top of mind. I think that gives us ammunition to go exactly to that other sort of key partnership that we really need to be developing more, and that's between the provider and the payer. The payer obviously is working to not pay as many claims as they can. And I think if we can show them that we are looking at personalized medicine, but in a cohort fashion, and utilizing data to sort of demonstrate that, therein lies opportunity for us to at least establish a catapult for us or a catalyst for further collaboration with our payers. So I think it's a great call out.
Now, thank you, Gyasi, and thank you for those questions, Shahab. I'd actually like to shift to Jack Cox. I know that Jack is joining us live now. And Jack, I know that you have some opinions around the topic of co-designed care between patient and physician. Can you perhaps provide us some insights and perspectives? And if you can join us live, we'd appreciate that.
Yeah, good morning, Gyasi. So good to see you.
Good morning. You as well.
couple of thoughts on that, and also a question for Gyasi. I think for too long, I'm a physician by training, a primary care doc, and it really has been, the way that we get to personalized health is I tell you what your problem is, I tell you what your options are, and that's personalized health, right? So it really has not, our systems, unfortunately, our structures have not really rewarded physicians for understanding at a core level what's important to you, what's important to you as a patient. And if you've got multiple comorbid conditions or multiple problems, what is it you want to start with first? And it may not be what I think as a physician may be your most important thing, but if it's important to you, that's where we need to start. So my question, Gyasi, having been in medicine for a long, long time and a physician executive on both sides, again, I was concerned that we weren't going to get to a disruption in healthcare that would help our transformation, much like most other industries have, like the automotive industry or IT or communications, because we had a lock, we had a monopoly, if you will. The reason
Right.
that we weren't in consumerism is because we had a lock. If you were a patient and you needed care, you needed to go to the structures that we had in place that was convenient for us. We were more physician centric and hospital centric than we were patient centric. So
Yep.
I'm curious about your thoughts now that we're seeing some disruptors in the market, the CVSs, the Googles, the Teledocs, the Walmarts. What role will the disruptors play in moving to personalization in healthcare? And any thoughts you might have on how existing healthcare systems should partner with those disruptors?
Yeah, great question, Jack, and thank you for it. And always great to hear your voice, and looking forward to reconnecting soon. I think, again, just a very provocative, I think, call out from you. One is, let me take your second point first. We have an opportunity, actually an obligation, a responsibility to be partnering with some of these newer innovations and disruptors in the market. I think it's our opportunity to make sure that there is, or ensure that there is collaborative spirit, and that there is a more patient-centric mindset moving forward, so that we get optimal results and optimal outcomes. You being a physician, you know that better than anybody. So that is, I think that's our opportunity, and it's before us. I think health systems, given that, we are not as agile as I would have hoped sometimes, I think given health systems that there are a lot of things that I think, have an opportunity to at least address, albeit industry standards, regulations, those kinds of things. I think our opportunity to not circumvent that, but at least ensure that the patients have the mindset and feel enabled to not have to always be beholden to what we say, is an opportunity to do the doctor on demand and teledoc and those kinds of things, just to ensure that they have what they need to further their care. So that's your second point. I think the first point for us is just the education, the empowerment. I do think that we need to do hastened, if you will, and a hastened approach on how we educate our patients. Again, healthcare is very, very convoluted. Whenever you get sick, whenever you're diagnosed with a disease, it is a scary and very tumultuous time, not just for you, but for your family. I think we have an opportunity, we being health systems and IDNs, have an opportunity to at least equip our patients with that. And even more so, then give them the resources, like some of the disruptors that we just discussed, so that they can feel even more empowered and more comforted that they've got resources at their touch point, utilizing phones or technology or what have you. So I think there's tremendous opportunity for us to continue to do that. As it relates to how healthcare will transform, and this is sort of where I think you're going to, is you've seen a tremendous, I think, call it evolution of healthcare over the last, call it 5 years, with value-based care. The key word in that is value. It's not necessarily our compensation or our reimbursement, but it's our value. What do we do and how do we get that in return? And it's not just our ROI, return on investment. It's more so our return on time, our return on quality, our return on some of the workforce and the workforce endeavors and culture that we're doing. I think that will really tip the scales and make sure that everything that you're seeing, hospital closures, hospital consolidation, hospital mergers and acquisitions, will be for, I think, the better in the long run, because it will be more streamlined, particularly as we're unfortunately waiting for patients to actually come to us versus actually going out and being proactive and getting out in the communities in which we serve, and in really administering care.
I'd like to jump in on this one too, if I may, Jack and Gyasi. If one thing is clear in this move to consumerism, is that the CVSs, the Walgreens, the Walmarts, they understand consumerism, and they've understood it for many, many years. So what's the significance of this? And this goes back to how we need to change our mindset and leadership in healthcare. What's the most immediate? There's a huge opportunity. Number one is, right now we know, because of this move to consumerism, healthcare systems are now partnering with large employers. Well, so is CVS, so is Walmart, so is Walgreens. But it goes beyond that. Is the opportunity is not to just say, if I'm, again, respectfully, Gyasi, I'm a cancer center. I want to be able to provide cancer care to your employees in your large establishment. The conversation shouldn't end there. The conversation should continue. Look, we're learning about consumerism. You guys are professionals at consumers. Let's understand how this is going to create disruption for you as a large employer. You see, most of your employees today are not just white people. They come from all shades and backgrounds. Now, how have you as a large employer dealt with that mass disruption of just your workforce? And then how can we as healthcare systems and healthcare experts do a better job in saying, look, you have vulnerable populations here. Your aging population is on is high susceptibility to this chronic condition. Let's get out in front of those chronic conditions that are most susceptible to Black and Hispanic communities by putting forth programs, preventive care programs here. And all along, how can we get large employers to start educating healthcare systems on how to even address the social unrest issues in the United States? That is something that is not relatively new to large employers, but is brand new for healthcare. And if not treated and handled properly, this can be the big fuel that makes current healthcare brick and mortar irrelevant, as these diverse populations want to see healthcare delivery in a different way. So where I'm trying to get at, and it was probably kind of broadening the question that I think you were after, Jack, which was a very good question, but I think we're missing the opportunity to truly engage in a more inclusive way with these brands that understand consumerism. And if we were just vulnerable to the things that we just don't know, they could be an incredible source for us to understand what consumerism is. But on the flip side, healthcare can help large employers understand what personalization is, because they want to become more personalized in how they're marketing their brand, how they're treating their employees, how they're best serving the communities that they're serving, when this is something that has been inherent in the healthcare model. Empathy, community, compassion. These are not words that large corporate juggernauts think about. Those are not new words to them. So I think that there's what's new to us has been something that's been historically in a way that large employers have operated, but there are some things that have been inherently a part of healthcare that large employers have been quite candidly ignorant about. And so this large employer system partnership, I think, has not been tapped into to its fullest. Do any of you want to react to the statement I just made?
Yeah, if I may, and I think that Gyasi made a really good comment. You know, the whole comment about value-based care. I think one of the disconnects that we have, Glenn, is the disconnect between healthcare and health and well-being. So just because you deliver healthcare does not necessarily mean that you're delivering health and well-being as defined by the consumer. The problem,
that's right.
one of the problems that we have in healthcare today is that the value-based healthcare metrics are defined by the payer system, not necessarily by the consumer. So, for example, if you look at the standard definition of value, it's quality divided by cost, right? But what it doesn't ask is the fundamental question of, does this improve the patient's life as defined by the patient? I can give you cost-effective joint replacement all day long. What I can't do is tell you that, you know, a third of the joint replacements we do don't necessarily improve the health and well-being of the consumer, the patient. So I think when we talk about personalization, value has to be defined by the consumer. And with regard to the large employers, they benefit when you have an individual that has optimized health and well-being. So how do we connect the whole standards of healthcare with the concepts of value, health, and well-being from the consumer's perspective, which will benefit the large employers? Hopefully that makes some sense.
It does indeed for me, Jack, and certainly thank you for the question, Glenn. I'll chime in here and try to pledge brevity in my comments. But Glenn, you asked such a broad question that needs unpacking, and I think it's probably the most important thing. And hopefully your audience here will have a few takeaways. I think we're really at a sweet spot in terms of the convergence between healthcare, the healthcare industry, and now not being treated such as a cottage industry, more so a horizontal industry that cuts across the entire diaspora of the American experience. I think there's inherently our opportunity to do that here while working with, to your point, major employers amongst the sort of the fire industries. If you guys know what FIRE stands for, it's the finance, the insurance, the real estate, and the economic industry, which has for years sort of been at the crux of what we do, how we do it, and had the largest voice, I think, in this country. If we can sort of find the sweet spot between the two of those, I think inherently there is so much more opportunity that we can do together to really find some solutions that will sustain themselves. So I think let me get sort of global and then get a little bit more granular. What I think we need, particularly in our workforce amongst healthcare, is a true understanding of entrepreneurialism. Having an entrepreneurial spirit, really sort of understanding how we access healthcare, what we buy, why we buy it, is very, very important, which I'll come back to here in a second. And then understanding, too, the environment in which some of the patients that we serve really gets to the social determinants of health, really gets to that personalization that Jack was talking about. So, I think those two E's, entrepreneurialism as well as environment, understanding those two things is really, really important. To get a little bit more granular, and this is where the employers come in, Glenn, to your point, very cogent point, is they understand two things really, really well. One is retail. They definitely understand retail and the why behind retail, and they understand risk. Risk meaning what do we really need to do? How do we really need to do it? What's sort of driving a consumer's risk to really purchasing either more healthcare or different things that will enhance their lives around the health? Like Jack said, it's not just the care, but the health, their well-being. And then thirdly, if you kind of go down even further, then you inherently have what healthcare has, and I think has a really, really sort of core competency on, and it's exactly what you said. It's the compassion, it's the empathy, and a lot of what I've seen and what I've just been sort of warms my heart throughout this whole pandemic is our frontline staff. I've been in all 5 of our hospitals throughout this pandemic, and our frontline staff, they're in it for the right reasons. They're understanding that this is a very tumultuous time, and that they're really caring for the patient almost as if they would want to care for the care that they would administer to their mother or their sister or their brother. That's very important. And that's what I don't think that, to your point, employers have. So if we can meet somewhere in the middle, get that sort of sweet sauce, that sacred space, I think we really have something here. And you're right. You're absolutely right, Glenn. Now more than ever is the time to be partnering with big employers. And
again, I think they want it. So I don't know what's
stopping
stopping us. They're hungry for it. So we've just got a little bit more time here in Gyasi. We can talk to you for another hour, but I do want to address something. And his name is Victor Parada, and I believe he's with NBC Universal. And he brings up the point of the Hispanic market and CTCA's commitment to the Hispanic population. I'm going to have him get on live. Victor, are you there?
Hi, yes. Good afternoon.
So good afternoon. Thanks for joining us, Victor. Again, being respectful of time. I mean, it seems to me that you want to get a sense from Gyasi's leadership. How open are they to really addressing and the needs of the Hispanic population? So I don't know if you wanted to address that a little bit further, recognizing the time limit we have. Thank you.
Thank you. No, just briefly, because I mean, in years past, going back 2-3 years, we had engaged in conversations with marketing folks at the organization. It seems that there were some constraints as far as insurance, as far as being able to serve the business model of the organization, and Hispanics seemed not to be the most profitable segment. But I'm wondering if that has changed, especially I think in Arizona where regulations have changed, and I think the payer situation has changed. So I'm just curious.
Yeah, Victor, if I'm understanding your question, and thank you for it, has anything been altered, amended to really look at specific populations, namely the Hispanic community, by way of care or healthcare? Is that an accurate depiction, or am I missing?
Yes, that's correct. Thank you.
Okay. No, thank you. Great question. I do think that we've made some strides and we've created some structure, and I would say structure leads to strides around some of how payers reimburse us and how they look at populations. The one thing that I'll say that is quick to note, and I know we're running short on time, is that I do know that payers now are working to insert themselves more into the community and working to be a little bit more proactive, understanding that once a chronic disease gets to a certain threshold or a certain state, that it's even more expensive to treat that chronic disease, particularly for what I call disenfranchised communities, the African-American community, the Hispanic community, et cetera. So I do know that there's been a strong push for that. I don't think that there's been enough around that. And that's one of the things that sort of Glenn outlined in the community aspect of all of this. We have, and I think providers in particular, have an opportunity to be the staple of the community even more. Get out into communities in which we serve. If we know that there's a food desert in that particular community, and I've worked in several, call it underprivileged areas where I've run hospitals, that's an opportunity for us to do a farmer's market every Saturday, or do something innovative or special to really address the needs and the deficits of that particular community, because we know in the long run that will not only ensure that we've got more well-being for care, for the health and well-being of our constituents, as well as the patients in which we serve, but that will also build the community up. So I think we have an opportunity to address those deficits in a greater form and a greater platform, and not just wait for payers to do their actuarial kind of things based on their analytics, which we know we have a ton of. We're living it, seeing it, breathing it every day. And I think we need to be in our communities even more, not afraid to roll up our sleeves and sort of understand our dynamic.
Thank you, Gyasi. And thank you for that question, Victor. Really appreciate your time. Gyasi, we got about a minute left. Why has healthcare reached its tipping point, and what inspirational close can you provide us with?
Well, I think it certainly has reached its tipping point, to borrow Gladwell's phenomenal book there, for several reasons. One is because we have, I think, a very specific and very narrow moment in time to do some meaningful change. I don't want to look at this moment in time and look back this time next year after a really tumultuous 2020 and say, gosh, remember 2020 and we're in 2021? What if we could have done this? I want to go no holds barred. I want to partner with whomever and really start not to look at, are we fulfilling our mission? Are we looking at our vision, our values? Are we caring for patients? It's not enough anymore. We've really got to make sure that we carry this momentum into actually action, which I think is movement. And movement really requires not only partnerships, it requires leadership, it requires a lot of things coming together and the confluence of things coming together at the right time to make meaningful change. I'm raising my hand, saying that number one, I'm complicit, but also number one, I'm willing to change as well. So anybody that is willing to work with me, I'm all ears, I'm all eyes, and please let's get after it in a very, very meaningful fashion and fast fashion, so that we don't have any regrets moving forward.
Gyasi, thank you so much. And by the way, this is going to be the opportunity at the 2020 summit that'll take place October 28th to the 30th, just to give our audience a little sneak peek. So as we go through the 3 days, we're going to create pods of partnerships between the different speakers throughout the 3 days that are solving for the same things, but may be packaged a different way. So the objective of the summit is to bring to bring the diversity of thought throughout the days, throughout the different industries, so that they can do exactly what Gyasi is really pushing here is, how do we start creating momentum? How do we move forward? How do we change the mechanisms in which we have solved things in the past, given all the things that we've learned, and recognizing that the luxury of time is over. So Gyasi, you've inspired us today, as you always do. Thank you so much for your time. And as we close, when you lead in the age of personalization, you will see things that others don't, do what others won't, and keep pushing when prudence says quit. Let's keep pushing, Gyasi.
Let's keep pushing. Thanks, Glenn.